article publication entitled Supporting Every School to Become a Foundation for Healthy Lives in the Lancet magazine on January 22, 2021, it is important to underline the role of health education at school, along with the challenges and issues arising from it, which are highly related to the context of every individual, their local knowledge and background. In order to learn more from the COVID-19 crisis and other pandemics, we must address the issue of health education using a complex approach that involves biological, social, sexual, cultural, psychological, economic, historical, and environmental aspects. We believe that individual health influences and contains collective health and vice versa. Notwithstanding, health education and health promotion in societies begin at schools that are the real incubators for the actors of the future. Helping schools and establishments into taking into consideration their students' health is crucial in protecting them, informing and educating them on how to be responsible for their own health and that of others. Early interventions, especially in schools, have a greater impact than those aimed at reducing the risks and restoring health during adulthood. It is therefore about transforming every school into a solid foundation for students' health. A strategy based on health promotion must include a range of intersectorial actions coordinated at the national, regional, local, and academic levels. It must be geared towards enhancing as well as protecting the health and well-being of every individual who is learning or working at school. Reducing inequalities is also at the core of such approach, as advocated by the Sustainable Development Goals. To think that every problem has only one solution and that all schools, regardless of their context they fall within, are able to follow the same health education program would be very delusional. Therefore, the main issue would be to find the right way to create an adequate environment that would allow every school within a great variety of educational contexts to adopt practices that positively influences health. The challenges in that lies first in the fact that education programs must often tackle specific and very limited dimensions of the academic life. Fragmented and monodisciplinary approaches that target a simple aspect of health only, such as the mental or biological aspects, remain inefficient. Three fundamental axes affect the evolution of educational systems in terms of health education: educational policies, structures and systems, as well as human resources. Close collaboration and a systemic thinking involving all relevant actors and factors are crucial in this regard. Findings reveal that school staff professionalism and engagement are key elements, provided that coordination takes place among various health actors and professionals based on an ecological approach. Among school counselors, teachers, dentists, nurses, physiotherapists, physicians, speech therapists, pharmacists, and even parents, to name a few. Nonetheless, the key to success for such an approach entails a paradigm shift in training strategies and design targeting teachers and health actors. These strategies can no longer be limited to an accumulation of modules. They must be part of a complex and interdisciplinary vision that involves project pedagogies and conceptual change. Shifting from a linear approach based on fear, infantilization, and prohibition towards a complex approach focused on skill development and building a new connection to one's health in an autonomous and responsible way requires shifting from the idea of teaching to the idea of educating, and thus a new perception of the learning subject who is responsible for their own deliberate choices. Providing each school with the necessary means to use its full potential in favor of students' health entails creating the right conditions that enable the school to become an inclusive, equitable, and secure establishment, all while offering education and building an environment that fosters health today and in the future. It also requires accepting to interact with the unknown, uncertainty, and unpredicted events, similar to the current health crisis we are facing now. Resolving complex issues is made possible by accepting a new method of thinking, as well as a new perception of the world and education. The ultimate goal is to build skilled citizens who are able to anticipate and make responsible and deliberate individual and collaborative choices pertaining to health. It is to build a generation of youth who are able to adapt and confront all uncertainties unfold by the 21st century, who are able to take into account local knowledge and indigenous contexts, yet who are also open to and aware of planetary issues. All this highlights the importance of the integration of the complexity in health education programs.